Doctor, is it true that on direct examination you stated that the patient had a fracture of the temporal bone? That is true. And usually, is that concurrent? Yes, it is usually concurrent in the middle ear involvement, which signals by hearing loss and paralysis of the facial nerve that there is a fracture. Doctor, what is mastoiditis? Mastoiditis is an infection of the middle ear which has extended to the antrum and mastoid cells. Doctor, is that called mastoiditis? Yes, mastoiditis may be acute, subacute, chronic, and recurrent. Doctor, is that a middle ear effusion? Well, it can result in the effusion from the middle ear, which can be acute or chronic, with presence of fluid in the middle ear, generally without infection. Doctor, what about the secretory otitis media? Yes, that is the mucoid otitis media, or glucotitis. Doctor, that is a thick, cloudy, viscous exudate? Yes, it is. It is an exudate in the middle ear containing cells and mucus strands. Doctor, is that serous? Yes, it is serous otitis media with hemotympanum. Is that a serum? Yes, serum and blood in the middle ear space. What does that result from, doctor? That results from temporal bone fracture, tumor, or blood disorder. And otitis media? Otitis media is simply the inflammation of the middle ear. Common types encountered are acute suppurative otitis media. Doctor, don't relate all the rest of them. Well, I was about to, though, to be complete with the answer. Go ahead. It is marked by intense congestion of the mucosa of the middle ear. Is that a blockage, doctor? Yes, a blockage of the eustachian tube, serous exudate, which becomes infected, and the rupture of the eardrum. Doctor, is that a bacterial invader called Staphylococcus aureus? Yes, Staphylococcus aureus. Also, it could be Diplococcus pneumoniae and Streptococcus pyogenes. Doctor, is that hemophiliac? That is hemophiliac, yes. And that is chronic? It is suppurative otitis media. What is it characterized by, doctor? It is characterized by continuation of the middle ear infection resulting in protracted suppuration. Doctor, what is salpingitis? Salpingitis of the eustachian tube is an inflammation of the auditory tube. And may it be acute or chronic, doctor? Yes. What about the conditions of the middle ear and inner ear? Well, those are different. The acoustic neuroma is a benign tumor of the 8th cranial nerve, which is affecting more the vestibular branch than the cochlear branch of the nerve and causing vertigo, tinnitus, and hearing impairment. Doctor, what is labyrinthitis? Labyrinthitis is inflammation of the labyrinth, usually secondary to acute or chronic suppurative otitis media with or without cholesteatoma or to acute upper respiratory infection. Doctor, what is Meniere's disease? Meniere's disease is an endolymphatic hydrops, which is neurologic as a disorder in its classic form, exhibiting a triad of symptoms complex. Doctor, is that an explosive attack of true vertigo? That is correct. Fluctuating, does it? Yes, it fluctuates with the hearing loss of the sensorineural type. Is there also tinnitus? Yes, tinnitus, or sounds in the ear. And what is dizziness? Dizziness, ataxia, and a feeling of fullness in the ear are usually present. Are there remissions, doctor? Yes, there are remissions which may last for many years. And otosclerosis is a recently termed otospongiosis. Yes, the otospongiosis is a newly formed spongy bone replacing the hard bone of the labyrinth. It may result in conduction deafness with fixation of the stapes and stapedial footplate, followed later by nerve degeneration, resulting in mixed deafness. Doctor, vestibular neuronitis you mentioned in your hospital report. Yes, that is a sudden vestibular failure in one ear without hearing impairment or tinnitus, apparently due to viral infection or a demyelinating reaction to infection.